This educational content is provided by Dr. Keshav Narain, a leading expert in retinal and optic nerve care at South Bay Retina. Here's a twist. Not all vision problems start in the eyes. In fact, sometimes the very first sign that something is wrong in your body can show up in your vision long before you feel sick or notice anything else unusual. It's a reminder that our eyes are not just windows to the world, but also windows into our health. Sometimes the trouble begins deep inside your brain, right next to a tiny but powerful gland called the pituitary. This gland, though only about the size of a pea, plays a massive role in keeping your body in balance. It's tucked away at the base of your brain, almost hidden, but its impact is anything but small. And when that gland gets in trouble, your sight can be the first to know. That's because of its close relationship with the nerves that carry visual information from your eyes to your brain. Even a small change in this area can have a big effect on how you see the world. Today, we're exploring how a pituitary lesion, a small growth near this gland, can quietly cause big changes in your vision, and how modern eye care can catch it before permanent damage happens. These lesions are often slow-growing, and symptoms can sneak up on you, making early detection both challenging and crucial. Let's start with the basics. What is this pituitary thing, and why does it matter for your eyes? The pituitary gland is sometimes called the master gland because it controls so many other glands in your body. It releases hormones that affect everything from your growth and metabolism to your stress response and reproductive system. The pituitary gland sits at the base of your brain, controlling hormones that influence growth, metabolism, and stress. But its location is what makes it especially important for your vision. It's nestled just below a critical structure called the optic chiasm. Just above it? The optic chiasm, a busy intersection where nerve signals from both eyes cross paths. This crossing allows your brain to process visual information from both sides of your field of view, giving you depth perception and a wide visual field. When a pituitary lesion, usually a benign tumor, grows upward, it can press on the optic chiasm. This pressure disrupts the normal flow of visual information, often in a very specific way because the fibers that cross here carry signals from the outer, or peripheral, parts of your vision, and that's where vision problems begin. The first thing many people notice is a gradual loss of their side vision, which can be so subtle that it's easy to miss at first. You might not realize anything is wrong until you start having trouble seeing things out of the corners of your eyes. One classic sign is losing your peripheral vision on both sides, something doctors call bitemporal hemianopsia. This means the outer halves of your visual field in both eyes are affected, making it hard to see objects or people approaching from the sides. But it might just feel like bumping into things or missing what's happening at the edges. Everyday activities like driving, walking through a crowded room, or even reading can become more difficult, and you might not connect these problems to your brain at all. Here's the tricky part. These symptoms can be subtle. They often develop slowly, and you might adapt without realizing it, turning your head more or relying on your central vision. That's why regular eye exams are so important, especially if you notice any changes in your vision. Some people think it's just eye strain, others blame aging. It's easy to dismiss these early warning signs, especially if you're otherwise healthy or have no history of eye problems. But your eyes might be the first to signal a hidden brain issue. That's why understanding the connection between the pituitary gland and your vision is so important, because sometimes protecting your sight means looking deeper than the eyes themselves. So, how do we catch a brain-based vision problem early? The answer lies in a careful blend of technology, expertise, and a keen eye for subtle changes. Many brain-based vision issues can develop quietly without obvious symptoms at first. That's why early detection is so important. It can make all the difference in preserving vision and overall brain health. At South Bay Retina, we use a combination of advanced imaging and clever tests that act like detectives for your optic nerves. These tools help us look beyond the surface, allowing us to see what's happening deep inside the eye and along the pathways that connect your eyes to your brain. It's a bit like having a window into the nervous system, giving us clues that might otherwise go unnoticed. First up, OCT. or optical coherence tomography. This is a non-invasive imaging test that uses light waves to take cross-section pictures of your retina. It's quick, painless, and incredibly detailed. Think of it like an ultra-high-res photo of your retina. So sharp, we can spot thinning in the nerve fiber layer before you notice any changes. This thinning can be one of the earliest signs that something is affecting the optic nerve, even before you experience any vision loss. By catching these changes early, we can intervene sooner and potentially prevent further damage. We also use these images to track changes over time, comparing scans from previous visits to see if there's any progression. This helps us tailor treatment plans and monitor how well therapies are working. Next, visual field testing. This checks the edges of your vision for gaps. It's a bit like mapping out your entire field of view, making sure there are no blind spots or areas where your vision is weaker than it should be. Pituitary lesions often create a very specific pattern that's hard to miss once you know what to look for. For example, a loss of vision on the outer sides of both eyes, called bitemporal hemianopsia, can be a telltale sign of pressure on the optic chiasm, often caused by a pituitary tumor. Recognizing these patterns early can lead to faster diagnosis and treatment. And then there's visual evoked potentials, or VEP. This test measures the electrical activity in your brain in response to visual stimuli. It's a way to see how efficiently signals travel from your eyes to the visual cortex at the back of your brain. It measures how fast your brain responds to visual signals, a bit like checking the wiring in a house. If the response is slower than normal, it could mean there's a problem somewhere along the visual pathway, such as compression or inflammation. If the signals are delayed, something might be pressing on the pathway. This could be due to a tumor, swelling, or other neurological issues. By identifying these delays, we can pinpoint where the problem might be and take action before it leads to permanent vision loss. By combining these tools, sometimes even before MRI changes appear, we can spot trouble early and guide patients to the right specialists. Early detection means better outcomes, more treatment options, and the best chance at preserving both vision and quality of life. That's why we're committed to using every tool at our disposal to protect your sight and your health. Here's the good news. Catching a pituitary lesion early can mean preserving your sight and avoiding more serious complications down the road. Early detection gives doctors a chance to intervene before the tumor grows large enough to affect your vision or other important functions. It also means you're more likely to have a wider range of treatment options and a better chance at a full recovery. Regular checkups and paying attention to subtle changes in your health can make all the difference, and getting the right treatment faster is crucial. For many patients, treatment involves a neurosurgeon carefully removing the growth through a tiny opening near the nose, a minimally invasive method called the transsphenoidal approach. This technique reduces recovery time and lowers the risk of complications. When we catch pituitary lesions before major vision loss sets in, recovery is often smoother, and patients can return to their normal lives more quickly and confidently. This is more than just an eye story. It's a reminder that your vision is connected to your whole body. Eye exams can reveal hidden issues in the brain, hormones, even your overall health. So, the next time you notice changes in your vision, especially side vision, don't ignore them. Your eyes could be sending you a brain-sized message. At South Bay Retina, we're here to help you see the full picture and keep it that way. Schedule your checkup today, and let's keep your vision in focus for years to come.